Effleurage. Techniques variations. One-handed raking. To use the raking technique, the fingers should be together or apart, moving in one direction. The purpose of this is to check the proper alignment of muscles. One-handed ironing. Using of forearms and knuckles. A deep one-handed effleurage, often done with the forearm, knuckle, fist, or palm of the hand. The deeper the glide, the slower the move. This technique calms the nervous system when done slowly. One-handed circular. It can be performed around the shoulder, hip, knee, and abdomen. It relaxes the client and prepares an area for deeper stroke. Two-handed heart. Performed up and down for the back in a heart shape up the leg or up the arm. It increases blood and lymph circulation and relaxes the client. Two-handed circular. One hand may be placed next to or on top of the other hand. This technique relieves insomnia. Alternate hand raking. The index and middle finger forming the letter V may be placed on either side of the spine. It is used to move from one side of the table to the other without losing contact with the client. Alternate hand circular or sun moon. It can be performed as one hand circles a region and the other hand moves behind the first hand in a half circle or a crescent shape. Nerve stroke. It is considered as light effleurage, feather-light like finger tracing over the skin, used as a finishing stroke in massage therapy. It is typically done at the end of massaging a body segment and at the completion of the massage. Petrissage or kneading. Techniques variations one-handed. The entire hand or the pads of the fingers and thumb can be used to lift the tissue. This variation is well suited for smaller muscular areas such as the arms, top of the trapezius, or the arms and legs of a child. Both hands are lifting, compressing, and releasing the tissue simultaneously. It is often used to address larger muscular areas such as the back. Two-handed praying hands. Fingers are interlaced in a praying hand position. It helps maintain proper position. Two-handed ocean waves. Use a back and forth movement while the hand opposes each other, lifting the sides and pressing down while on top. It is typically applied across a larger muscular area or horizontally down the back. Alternate hand. Lift the skin and underlying tissue with one hand and compress. Next is lightens the grip enough to allow the muscle tissue to be released while still remaining in contact with the skin. Repeat the first move with the opposite hand. Do not lose contact with the skin while switching hands. It is done to stimulate the nervous system and improve cellular nutrition. Fulling. Grasp the tissue with both hands. Lift it up and away from the bone while spreading it out laterally. Repeat the movements until the tissues feel warm and elastic. It is effective for broadening muscles and their related tissues and mimics the movement of a muscle when it contracts. Skin rolling. involves lifting and compressing the skin and superficial fascia. It is the technique essential to Bindigi-Webb's massage, or the connective tissue and myofascial release. It is one of the few massage techniques that may be applied over bony areas. Grasp and lift the skin between the fingers and thumbs, compressing the tissue. Roll the skin as though you're rolling a pencil, using your fingers to scoop up the skin as you move across the area. Friction or rubbing. Techniques variations, superficial warming. It is also known as heat rub. It generates heat by creating resistance to motion. Place both hands palm down on the client's skin. The fingers of each hand should be together firmly. Move the hands briskly and simultaneously in opposite directions. One hand moving towards you and the other hand moving away from you. Subvariations, sewing. Fingertips, knuckles, or ulnar surface of one or both hands may be used if the surface area treated is small. Compress the tissue firmly with open palms and extended fingers of both hands. It is best suited for the extremities. Rolling. Roll the skin, muscle, and surrounding tissues around the bone, moving both hands in opposite directions. As you roll the tissue around the extremity, use a back and forth movements while you compress the tissue and slide your hands from distal to proximal. Wringing. While compressing the lubricated tissue on all sides with palmar surfaces of the hands and fingers, move the hands in opposing directions. Slide the hands toward the trunk of the body during the massage movement. Wringing friction is performed vigorously, like wringing water out of a cloth. The movement is best suited for arms, legs, and fingers. Cross fiber. It is also known as deep transverse friction. It is a very precise and penetrating form of friction. The direction of movement should be across and perpendicular to the pattern of muscle fibers. One or more fingers are placed on the skin at the exact site of a pain or injury. Apply firm, consistent pressure in one or both directions. Move the fingers in a back and forth motion. Chucking. It is also known as parallel friction. It refers to deep friction and applied in the same direction in muscle tendons or ligamentous fiber. It uses the thumbs or fingers to rub back and forth, moving the superficial tissue over the underlying structure. It is usually performed one-handed, while the other hand is supporting the limb that is being massaged. This movement is often applied between bony areas. Circular friction. It uses a small circular movement that glides superficial tissue layer over underlying tissue layer in different direction using the fingers or palms of the hand, particularly useful around the joints and in bony areas. Vibration. Techniques variations. Fine. Place fingertips on the skin and begin a trembling movement by rapidly contracting and relaxing the arm, keeping the fingers and wrist stiff. Fingers should be moving from side to side while maintaining contact with the skin. The therapist's hand may remain in one location or glide down or around an area, such as the back, legs, or arms, while applying quivering movement. Jostling. It is also known as course. It can be used on a muscle belly or limb. When applying it to muscle, grasp the muscle belly or bellies and shake vigorously, but rhythmically back and forth. This may feel like rolling friction. Coarse vibration. The therapist grasps the muscle or limb with one or both hands and shakes or pulls it vigorously. Rocking. It is done by pushing the client's body with one hand or tossing the body back and forth on the table between two hands. It requires a pitch and catch motion. Push or pitch the body with one or both hands, retrieving or catching it as the body swings back towards you. Pitch and catch the body until it begins to move easily or finely. You can also pitch and catch the body using one hand on each side of the body. Tapotment or percussion. Techniques variation tapping. Punctuation. Using your fingertips of one or both hands, strike the body surface rapidly, but consistent delivery of pressure and speed. A hard version of tapping punctuation tapotment is excellent for the soles of the feet. Pulsing. It is performed one-handed, with an alternate deep and light tap. The deep tap is comparable to a full note, and the light tap is comparable to a half note. Raindrops. Commonly used on the face or scalp. Feels like light rain. Each fingertips of the hand strikes the skin lightly at a different time. Pincement, also known as plucking. Done the same as the skin rolling technique. The skin is grasped using a quickly delivered striking motion, lifted and released while the fingers of the opposite hand follow suit. Hacking, also known as karate chop, produces a slight vibratory action coupled with a percussive action. Hacking along muscle fibers with fingers parallel produces relaxation in muscles. It is applied across large muscles with the fingers perpendicular, stimulates muscle spindle activity. Quacking. Place the palms of both hands together. The skin is struck using only the sides of the third, fourth, and fifth finger. The air moving out of the hands during the strike make a quacking sound. Cupping. Curve the palmar surface of the hand into a cup, as if holding water. Strike the client's skin with the edge of a cup hand, making a muffled horse hoop sound. A vacuum is created when lifting the palm from the skin's surface, hence the hollow sound of suction. Pounding. It is performed with the sides of one or both loose fists contacting the skin alternately. Loose fist beating is used on large, muscular areas such as the posterior legs and the hips. Wrapping. Performed using a loose fist placed palm down, striking the skin surface like the therapist knocking on a door. Diffused. It is commonly used over the abdominal region. Drag the open hand across the skin as you move across the skin surface. Clapping, also known as slapping. It is performed with the palmar surface of the hands and fingers striking the skin with alternate strokes. The fingers are held together. A loud smacking sound is heard if done correctly. A light upward slapping may be done on the sides of the face. Swedish full body massage in prone position. Assist the client to position on the massage table in prone position or lying horizontally on the massage table face down. Ask the client to remove his clothes. To do this properly, use a towel to prevent the client from being exposed. Cover the lower back of the client using the towel you are holding. Place the bolsters under the shin or front of the legs. Then put another towel to cover the upper body. the back. Apply alcohol or hand sanitizer on your hands and forearms before starting the massage. Perform stretching on the client's body. Pull the towel on the upper body down to the lower body, exposing the back of the client. Apply lubricant on your hands. Perform heart effleurage on the client's back for 3 repetitions. This technique will allow you to spread the oil on the body of the client. Lubricants are used to protect the body from skin irritation and give some nutritive value to the skin. Perform two-handed effleurage using knuckles for 3 repetitions. Perform two-handed circular for 3 repetitions. Followed by the chucking friction for 3 repetitions. Perform fooling petrissage for 3 repetitions. Followed by wringing friction for 3 repetitions. Do the ocean waves for 3 repetitions. Next is the one-handed ironing for 3 repetitions. Perform two-handed ironing for 3 repetitions. Perform cross-fiber friction for 3 repetitions. Massage using skin rolling for 3 repetitions. Do the one-handed raking technique for 3 repetitions. Followed by the superficial warming for 3 repetitions. Do the sewing friction for 3 repetitions. Followed by the one-handed circular technique for 3 repetitions. Performed heart effleurage for 3 repetitions. Followed by the alternate hand petrissage for 3 repetitions. Perform heart effleurage for 3 repetitions to end the massage on the back.